You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Herman Kupeyan. Dr. Kupeyan, welcome to the program.
Randy, pleasure to be here. Thanks for inviting me.
Now, before we get into today's topic, tell me a little bit about your practice. By the way, one online. Beautiful, beautiful office.
Well, thank you. It took a long time to get it that way.
What kind of patients are you seeing?
Well, my patients are typically a young individual, perhaps missing only one tooth, or at the other end, a 90-year-old that's been wearing dentures for 50, 60 years and has a problem with it.
Why would a 90-year-old want dental implants?
To get their life back. You know, they're tired of having these dentures moving around in their mouth and their bone is melted away, and they've been going and getting relines and adjustments and relines and adjustments. And you know what? There's a better solution for them today.
So somebody as old as 90 years old can be
Absolutely. You know, I had an 89-year-old that came in to me, said, Sonny, I go down south during the winter. All I have left is to go out to lunch with the ladies and play bridge. And she said, if I can't enjoy that, what's there left? She was a perfect candidate. Now, this 89-year-old lady, we gave her 5 implants in the lower jaw and gave her something that's totally non-removable. Unfortunately, she didn't have that much bone in the upper jaw, so we put 3 implants in there and clipped her existing denture onto it. Now, the lady has totally functional dentures without getting any sore spots. She doesn't have to go for periodic relines.
She's eating with the ladies now,
and she's eating and playing with the ladies. What
are the different categories of implant patients that you see?
Well, you got the young individual with a 1 tooth missing that's either congenitally missing or has trauma to it. You have people that are in between losing some teeth, you know, or have lost some teeth, or partial denture wearers. That's one category. Of course, we've got the total denture wearers. And the other category is those patients that go to the dentist and they've been told that their teeth have to go. So now their choice is whether they go through with dental implants or they get dentures.
Okay, now you say, and we talked on the telephone, you do it a little bit differently than it's done nationwide. That means you both do the surgery.
Correct.
And then you put the cap on top. And normally that's done by 2 different people.
Now, what makes it a little easier and better for our patients is that we also have one more thing, which is the in-house dental laboratory.
Okay.
So now we can do all 3 parts, and the patient isn't going from office to office today.
You say dental implant patients don't complain about pain. It's not a painful process. Hard to believe.
It is. And you know, with every case that I do, it's still difficult to believe how minimal discomfort that they suffer.
Do they fall out? I mean, they last as long as regular teeth, even longer than regular teeth?
Implants?
Yes.
Well, Randy, I've been doing them since early 80s.
All right.
And 98% of those implants are still in the mouth today. So I don't have a dental procedure that lasts that long.